Healthy livestock means food security and nutrition, improved livelihoods, and resilience for millions of Kenyan families. Yet the reality is that these services remain largely unavailable across many low and middle income countries.
So the major constraint affecting pastoral production is livestock diseases, which is often made worse by inadequate diagnostic and surveillance systems.
Karibuni to everyone. Welcome to this workshop on diagnostic for ruminant disease diagnostic and control.
Without the ability to accurately and rapidly identify disease, our efforts at prevention, treatment, and response are fundamentally compromised.
Diagnostic lab is critically important to be the part of the infrastructure. Yeah.
However, variability in laboratory capacities, test selection, quality assurance often undermines effectiveness.
So one of the weak points we've identified that we need to strengthen is the sample referral system. Right now we rely on courier services, but still it's very disjointed. So it means sometimes our clients don't get the samples to us in good time. Sometimes the samples aren't of good quality if they take too long. So these are some of the areas we want to be able to enhance.
In Africa, you have co-infections. So that makes diagnosis more complicated, especially if it's based on clinical signs, as many of the pathogens that you identify might not be linked to the clinical disease.
Viruses mutate and they adapt to new species. For example, avian influenza. I think my challenge to everyone in the room is also, what is the preparedness plan? Has work been done on the ground?
And here we look at training capacity, both for basic testing and advanced testing. We look at developing training material that can be hosted within our virtual learning center that is free to access, or within a government ministry associated website.
The transformation we seek in the animal industry sector cannot be achieved by government alone. It will require strong partnership, sustained investment, scientific innovation, and collective commitment.
And as government, we remain committed to working with government, with partners to expand access to affordable, field deployable diagnostics, to support innovation and strengthen sustainable delivery systems that reach farmers.
If you could implement 3 immediate actions to improve diagnostic use in Kenya, what would they be?
We propose to have mobile laboratories to improve accessibility so that the animal health practitioners and farmers are able to utilize this service.
Introduction of incentives for vets and paravets who take samples to the lab.
To improve laboratory quality management systems and biosafety and biosecurity.
So what partnerships are needed to make diagnostics more accessible and sustainable, also for smallholder farmers and pastoralists?
One area we thought was very important in partnerships is a regional partnership. Because if we look at the EAC and what IGAT, our borders are very porous. So if we do not have a regional partnership across the various countries, what's happening in Kenya can be destroyed by Tanzania.
We also need to consider the different farmer associations, because they'll be key in this, and also the research institutions, especially if you want to produce these diagnostic kits. So we need to innovate our local diagnostic kits so that we reduce the cost.
We are proposing, is there a way that the DVS could work very closely with the CDVS to ensure that this data is actually submitted by these even researchers?
and then also see avenues with which now this data can be analyzed by maybe the research organizations, institutions, for example, talk about ILRI and the rest, who can be able to now package this kind of information that can be used to derive what needs to be done.
I'm particularly encouraged by the progress being made in the operationalization of important policy and legislative instruments. Equally important is our continued alignment with international standards, including those of the World Organization for Animal Health and the World Trade Organization SPS framework.
And the discussions that you've held here provide a strong foundation for building a coordinated and responsive animal health diagnostic ecosystem in Kenya.
As we conclude this intensive two-day workshop, I'm filled with profound optimism, and today we depart with a collaborative vision for the future of the veterinary diagnostics in our nation. Thank you so much, and wish you safe travels back home. Thank you. God bless you.
Okay, thank you so much. Thank you so much.